Hi, Dr. Z here from Desert Breeze Dentistry. In today's video, we're going to be discussing an implant case that we did step by step. Dental implant is made of titanium alloy that goes into our jaw and it replaces the root of the tooth. And it's made out of several parts. We have the implant, which is, you could think of it as the root of the tooth, and then we have the abutment and the crown that goes on it. Let's dive into the case and talk about it. The patient presented to our office with a lot of pain on the lower right side on the tooth all the way in the back. After taking an x-ray, this tooth had a previous root canal done on it several years ago, and the patient was experiencing a lot of pain. After further evaluation, the tooth had a fracture on it and an infection on it, and unfortunately we were not able to save the tooth. So we told our patient what the options were, and a dental implant was a very appropriate option. After getting the patient very comfortable and very numb, the first step is the removal of the tooth and cleaning out all the infection and placing a bone graft in the area. What is a bone graft? A bone graft is made of material that's taken from a bone bank. It's very sterile and it's been cleaned and it's placed in the area of the tooth that we call the socket, which is the little hole area after the tooth is removed. And then we have to wait 3 to 4 months for the body to heal. If this was a front tooth area, we would make some type of partial, like a fake tooth for the patient to wear during this healing time. But this did not affect the patient's chewing or aesthetics, so we just left that area alone without a tooth because it was the very back tooth on the lower right side. After the area was healed and the bone was ready for an implant, a dental implant was placed in that area, and then we placed a healing abutment on top of the implant. A healing abutment is a round cap that sticks outside the gums, and that's where the future tooth is going to be, so it gets the gums ready. So after about 3 months, the implant was healed and ready to have a tooth on it. So during this visit, the patient is ready for the final mold or final impression. Sometimes people can do digital impression, but for this case, we did a traditional impression. We take a mold of the top teeth, a mold of the bottom teeth, and the bite, so we can replicate that in the lab, so the lab can make a really good crown for the patient. When the implant is healed and ready to go, we take the healing cap out of the implant, and then we put what we call an impression coping. It's that post that you see, so we can take the mold afterwards. And about 3 weeks after the mold was taken, we try the final crown in, and this was a screw retained tooth. First, we seat it, we take an x-ray and make sure it fits well, and if the patient likes the color and everything fits very well, then we'll do the final tightening of it, and then we'll fill it, and it's good to go. As you can see here in the picture, the blue color that you see on the teeth, that's just from what we call articulating paper or bite paper, and that comes off. But we didn't take a picture without it, so that's the only picture we have. As you can also see that in the middle of the implant crown tooth, there's a different color, and that's a filling that we put in. So after we put the crown in and we tighten it fully, then we put a little separator inside that area, and then we put a filling on top of it to seal it. The patient was extremely happy and now is ready to chew on the tooth and use it like a regular tooth. We are so grateful and blessed to be able to help people with their smiles. If you find this information valuable and you like our videos, please feel free to share it with people you know. You could also follow us on social media at Desert Breeze Dentistry on YouTube, Facebook, and Instagram. We would love if you subscribe to our channel and give us a like.